Now we will discuss secondary glaucomas due to the problem with the lens or due to a disease called exfoliative disease. Okay. Now we have the lens related problems. We have the lens related problems which are causing glaucomas. There are multiple types of glaucomas which can be closed angle or open angle secondary glaucomas. Okay. The first one is the Phacomorphic glaucoma. If you guys remember, we have discussed all these glaucomas of the lens in the complications of the lens in the previous lectures. Okay. So I will give you an overview. For detail you can go to those lectures. Okay. So what is Phacomorphic glaucoma? We know that in the senile cataract and tumescent stage, there is the hydration of the lens. When there is the hydration, the lens will swell up. Okay, it will swell up. Because of the continuous hydration, the lens will swell up and it will come against the iris. Okay, the lens will come against the iris and will block the pupil. Okay, and like the primary angle closure glaucoma, it will cause the accumulation of the fluid in the posterior chamber. The aqueous humor will accumulate in the posterior chamber and it will push the iris toward the interior chamber angle. Okay, in a dome shaped pattern called iris bombay, which will block the interior chamber angle. So the Phacomorphic glaucoma is causing a closed angle secondary glaucoma. Okay, it causes a closed angle secondary glaucoma. Now we have Phacolytic glaucoma. A Phacolytic glaucoma in the mature cataract stage. What is happening in the mature cataract stage? There is the proteins, most of the proteins. Okay, let me write again. Okay, so in the mature cataract stage, most of the proteins leaks out from the lens. Okay, and the lens shrinks down. Okay, because of the leaking of the proteins, there can be two types of glaucomas. Okay, so now the lens shrinks down because of the leaking of a lot of proteins. It causes two types of glaucomas, Phacolytic glaucoma and phacoantigenic glaucoma. And these both types of glaucomas, these are mostly, they are open angle secondary glaucomas. Okay, as these proteins will come and these proteins will accumulate, okay, on different surface of the eye. For example, on the retina, on the vitreous, okay, on the iris, and on the trabecular meshwork. Okay, these proteins will deposit in these regions. So, in directly the deposition of these proteins in the trabecular meshwork will directly block the perforations of the trabecular meshwork and will elevate the intraocular pressure. Okay, like the pigmentary glaucoma and like this Pseudoexpoliative glaucoma, as will be discussed next. It will block the perforations of the trabecular meshwork, which will elevate the intraocular pressure because of the accumulation of aqueous humor, and will cause the Phacolytic glaucoma, which is an open angle secondary glaucoma. Okay. Now the phacoantigenic glaucoma, because of the accumulation of these proteins, as we know that these proteins of the lens, they are hidden from the immune system during development. Okay, so when they are exposed to the immune system, what is happening? It will induce an antigen antibody reaction and will cause the inflammation of different surfaces of the eye. For example, in the retina and the vitreous, it will cause vitritis. On the retina, it will cause retinitis. On the iris, it will cause iritis, and with the ciliary body, iridocyclitis. And we know that on the trabecular meshwork, these proteins can cause trabeculitis. So directly due to the trabeculitis and indirectly due to the iridocyclitis, which will release the inflammatory infiltrate and these infiltrate will block the perforations of the trabecular meshwork. So by these different mechanisms of these inflammation, this is called a glaucoma which is called phacoantigenic glaucoma. Okay, because of the inflammation of different surfaces of the ocular surfaces, and because of the directly deposition of the inflammatory infiltrate in the trabecular meshwork, it will cause the elevation of intraocular pressure and hence glaucoma. Okay. Now we have the pupillary block glaucoma. So the pupillary block glaucoma is in the mature cataraceous stage when most of the protein leaks out from the lens. So the lens shrinks down, okay? The lens shrinks down and also due to the rupture of the zonules, okay? Because of the mature cataraceous stage and the shrinking of the lens, there will be the rupture of these zonules. And this zonular rupture will cause the dislocation of the lens, and the lens can come into this pupillary outlet and can cause pupillary block, which will cause the accumulation of the fluid in the posterior chamber, and again in the same pattern it will push the iris toward the interior chamber angle and will induce an iris bombay, and hence the interior chamber angle will be blocked. Okay, so it means that the phacomorphic and the pupillary block glaucoma, they are closed angle secondary glaucomas, okay, and the phacolytic and phacoantigenic glaucomas, these are open angle secondary glaucomas due to the iris. Okay, now the fourth cause of the secondary glaucoma, it is the pseudoexfoliative material deposition, okay, which will cause pseudoexfoliative glaucoma. Pseudoexfoliative, it is a multi-system pathology in which there is the accumulation of a dandruff-like material called pseudoexfoliative material, okay, which is made up of amyloid proteins. This dandruff-like material and amyloid proteins, they will accumulate in different organ of the body, and will cause a multi-system pathology. Okay, so for example, these pseudoexfoliative material, they can deposit in the brain, they can deposit in the liver, in the kidneys. Okay, but we have to focus on the eye. This pseudoexfoliative material, it will deposit in the interior chamber, in the interior chamber segment of the eye. Okay, it can deposit it. This pseudoexfoliative material will deposit on the iris, okay, on the pupil, on the iris, on the trabecular meshwork, on the endothelium. Okay, this deposition of the exfoliative material in the perforation of the trabecular meshwork will block the trabecular meshwork and will accumulate the aqueous humor in the interior chamber and posterior chamber, and it will elevate the intraocular pressure. Okay, this is called pseudoexfoliative glaucoma. Etiology is that there is the deposition of amyloid proteins, which is called pseudoexfoliative material or dandruff-like material. Okay, the pathogenesis, I told you that what is the pathogenesis. Pathogenesis, when this amyloid protein, dandruff-like material or exfoliative proteins, when they deposit in this trabecular meshwork perforation, it will block the trabecular meshwork and it will elevate the intraocular pressure. Okay, so how the patient will present to us? What are the clinical features? Remember that pseudoexfoliative material is also causing an open angle secondary glaucoma. As the angle is open, only the pseudoexfoliative material is accumulating in the perforations. Okay, so it is an open angle secondary glaucoma, and only 25% of the people with this pathology can have pseudoexfoliative glaucoma. Okay, and we know that when we look through the eye, we will have pseudoexfoliative material which will accumulate on the surface of the lens or on the pupil, on the lens, and we will have this pseudoexfoliative material in the perforations of the trabecular meshwork. Okay, and because of the accumulation of this pseudoexfoliative material on the pupillary margin, it will, when we it will retard the pupillary dilation. So we will have poor pupillary dilation with mydriatic drugs because of the accumulation of exfoliated material. And on the lens, in the surface of the lens, it is causing capsular opacities in a pattern that there will be the opacities in the center and there will be opacities of the capsule and periphery, okay, and we will have a clear zone in between these, okay. In between these opacities we will have the clear zone of the lens capsule. So these are the clinical features with the pseudoexfoliative material. Now how can we diagnose the condition? Again, the condition can be diagnosed with a gonioscopy, okay, which is the evaluation of the interior chamber angle with gonio lens. The treatment is similar as for pigmentary glaucoma, okay. First of all, we will get anti-glaucoma therapy like primary open angle glaucoma, and if it fails, we will then get laser treatment, okay, laser trabeculoplasty, and ultimately, in every case, as I am telling you again and again, that in every case, the last result with us is the trabeculectomy. Trabeculectomy is a surgical procedure in which we connect this interior chamber to the subconjunctival or subtenon space, okay. So this was about the secondary glaucomas caused by the lens and pseudoexfoliative material. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.